Mr. Riyad Matthew and the editor of the week,
esteemed practitioners and researchers in the profession of medicine, eminent panelists and delegates, friends from the media, and distinguished guests, and ladies and gentlemen. So I hope I'm not going to bore you with my classical speech after the very interesting talk we just had from the eminent personalities. But please bear with me in the next few minutes. It's indeed a privilege to be here this afternoon and to be part of this important, timely summit. As we discuss the role of medical health professionals and humanitarian aid in times of distress, I am reminded that my own organization, the International Committee of the Red Cross, ICRC, was indeed conceived amidst humanitarian distress 160 years ago. As we reflect on the enormous challenge the world faces today, it's become evident that the need of swift, efficient, and compassionate humanitarian aid is much needed. Whether it's natural disaster, armed conflicts, or pandemic, medical professionals are the critical workforce providing compassionate humanitarian medical aid by meeting health needs of those affected by crisis. The International Red Cross and Red Crescent movement is a global humanitarian network of 80 million people that helps those facing disaster, conflict, and health and social challenge. The movement consists of 192 National Red Cross and Red Crescent Society, the ICRC, my organization, and the International Federation of the Red Cross and Red Crescent. As we speak, the International Conference of the Red Cross and Red Crescent is happening in Geneva with its more than 192 national societies and other member of components. Members of the Red Cross and Red Crescent in various contexts also engaged in responding to healthcare and need, not only during the peacetime, but also during the crisis as a medical health worker and volunteers on front lines. Doctors, nurses, and healthcare workers not only treat physical injuries and illness, but also bring hope to communities who are going through the worst time of their lives, which has been mentioned earlier. In this moment of crisis, the health profession goes beyond individual care. It becomes a lifeline for entire communities. By offering medical aid with compassion, you embody the true spirit of humanitarianism, working tirelessly to alleviate suffering and ensure that every life is valued. The ICRC's humanitarian assistance include a wide range of health services and is mostly provided in collaboration with government and local health institutions. Community health programs in many cases run with the help of national societies and bring quality service to millions of people in need of basic health care, including the remote or hard-to-reach areas. The ICRC supports primary health care centers regularly or on ad hoc basis, providing supplies, equipment, financial assistance, and technical supports, training local health staff, and carrying out repairs or improvement of facilities in the areas where it operates. The regional delegation in India works closely with Indian, Nepalese, Maldivian, and Bhutanese Red Cross societies on disaster preparedness and response. In India, ICRC has also collaborated with state-level Ministry of Health institutions and other relevant partners to enhance their capacities in providing emergency medical care service through basic emergency care, which is called BEC, and has collaborated closely in the past with National Institute of Disaster Management, NIDM, in facilitating the health emergencies in large population, which is called HELP, for emergency responders. It also worked closely with Indian Red Cross Society on improving the quality of first aid trainings in the country. Globally, just to mention this morning, one of our recent operations was the establishment of a field hospital in Rafah, which is found in Gaza, in partnership with the Red Cross and Red Crescent movement, which since May has conducted over 30,000 casual consultations, performed 1,500 surgeries, and deliver more than 168 babies. Another recent deployment saw a specialized surgical team assist exhausted medical personnel in southern Beirut and Lebanon amid escalating hostilities. Also, as per our annual report of 2023, 734 hospitals worldwide receive regular ad hoc supports from the ICRC. Also, 1,753 first aid training sessions were held for around 41,000 people, including National Society and volunteers. As the State Minister mentioned this morning, the ICRC acknowledged the concerted effort of India as first responder and humanitarian assistance and disaster relief, HADR, at global level in recent past, including its leadership in providing COVID-19 vaccines in numerous countries to mitigate the challenge of unprecedented pandemic. The growing medical professionals in India plays a crucial role in providing immediate life-saving interventions immediately, aftermath of disaster, first aid, triage and emergency medical evacuation, trauma care service, surgical interventions, rehabilitation services. Along with medical teams, wide range of paramedical and health staff are involved in providing water sanitation, vaccination of drives, and carrying out laboratory services, which are important services during disease outbreak to confirm cases of Nipah virus like Mpox. India also extended this assistance beyond the border, like it did in Turkey and Syria in 2023. Also, the combination of advanced medical infrastructure, highly trained healthcare providers, and cost-effective treatment has also positioned India to become a destination of medical tourism. Ladies and gentlemen, it's also pertinent to mention that this year, ICRC celebrates 75 years of Geneva Conventions, or the International Humanitarian Law. Here, I would like to echo the ICRC's call for protection of medical personnel and facilities as provided for under IHL, International Humanitarian Law. No patient should be killed while lying in a hospital bed. No doctors, nurses, or any medical professionals should ever die while working to save life. India promulgation of the Epidemic Disease Amendment Ordinance 2020 is an apt protection to healthcare professionals and prohibit act of violence against healthcare service personnel or causing damage or loss to any property during an epidemic. Therefore, healthcare workers should be protected in all situations. I would also like to highlight that ICRC institutional strategy recognizes the importance of digital opportunities in healthcare, which the Minister has mentioned this morning as India's digital mission. The adoption of digital technology is currently transforming how health services are delivered, optimized access, enhancing quality of care, improving accountability, and reducing costs. Digitalization provides an alternative way to overcome the constraints of strengthening humanitarian response and increase healthcare access for millions of people. This is especially pertinent in developing and fragile contexts where the transformative potential of leverage digital technology can address unmet health needs. At the same time, digital technology also poses some threat on health infrastructure and protection of patients' data, which need to be addressed properly. It's important to mention one of the new initiatives of Ministry of Health called the BSHEM, portable hospitals that provide emergency medical care in disaster-affected areas and conflict zones, is an encouraging example of medical technology and emergent medical care. At the moment, this initiative is displayed in Geneva, where the International Conference of Red Cross and Red Crescent is taking place. As I conclude, I would like to not only acknowledge but applaud the key role the medical professionals provide in caring for the sick and wounded, especially in times of crisis. Amidst a myriad of challenges, medical personnel continue to provide the highest standard of medical care, guided by compassion and the principle of humanity. We, the humanitarian community, would work hand in hand and shoulder to shoulder, especially with all humanitarian initiatives led by India globally and in the region. Finally, I would like to thank the week for organizing this kind of important Health Summit and extending their invitation for us to be in this August gathering. Thank you.